Okay, we've got quite a few people already now, so we're ready to start. It's gone a bit too early. Right. So first of all, thank you for joining us today for this Lunch and Learn webinar, and hope you have your nibbles and drinks, water ready. I would also like to thank our event partner, The Perfect Gift, who are the reason on why we are nibbling and drinking on this beautiful Friday afternoon, wherever you are. And please do remember to redeem your voucher and activate it if you haven't done so yet. The Perfect Gift works with any place that accept MasterCard, and that's both in-store and online. So a great tool for your reward and recognition initiatives, as well as Christmas gift ideas. So very much well timed. Now, a bit of admin. Unfortunately, I can't tell you where the toilets are or the emergency exits or fire drills. However, I'd like to advise that in case of an alarm, please do not take large bites of your lunch. And in case of a fire emergency, I really have no idea what to do, but please make just cautious decisions. So, right, without further ado, I would like to cover some admin. And what that means is, oops, sorry, someone just messaging me whilst I'm talking. Now, unfortunately, without further ado, we are fortunate enough to be joined by Dr. Katharina Christalis, GPDQ Clinical Director, who is also serving on the NHS frontline. Hi, Katharina.
Hi, Lucas. Hi, everyone.
And the reason why we have decided to do this webinar is we are obviously very proud by the brilliant work that Katharina is doing to help us navigate on how to keep employees and employers safe at work, but also protect employers and support them with mitigating the risk of outbreaks. We have been hearing from our existing customers and also from frontline doctors on how challenging it's been to be able to protect everyone and to do so safely with a clear purpose to get a healthy working routine. And all of that actually inspired us to be able to share with you something of use and give you some practical insights from a doctor that is operating on the front line, as well as being able to offer valuable advice to our businesses. You'll be able to ask questions directly to our practicing GP, and please do so in the question and answer field rather than in the chat box. This session will allow you to learn a bit more on what is happening next and what the new ways of testing and what's advancing, because we recognize that advice coming from the government has been challenging to follow and quite difficult to manage. Dr. Christalis, thank you so much for all the phenomenal work that you do in current environment, and the Lunch and Learn session is very much about learning a bit of knowledge. So my name is Lucas, and I am looking after our corporate health initiatives for our customers and partners, but we are here to learn from Dr. Katharina Christalis, and it will be a pleasure if you could introduce yourself to the participants.
Fantastic. Yes. Hi, Lucas. Hi, everyone. So I'm Katrina, as Lucas said. I'm one of the clinical directors at GPDQ, also an NHS GP and private GP. And I wouldn't claim to be an expert at the moment on COVID, but obviously this situation has required us all to become knowledgeable. And what we've tried to do at GPDQ is put that knowledge that we've acquired on the front line and that we've acquired in our day-to-day practice to the use of employers, employees, and we would like to share a little bit of that with you, as Lucas said, and how to best keep you safe at work. So that as what the government is trying to do, they're trying to balance at the moment with lockdown, trying to balance the economy, trying to balance health so that we can play our part in trying to balance that and make it safer as possible for you to return to work and resume some form of normality in the safest way possible.
Thank you so much. That is so crucial for all of us. Now, bit of an agenda of what we will be covering today. So there are a few things that we have prepared for you, and that is around how we were able to date of to contain the virus, and sort of our and clinician understanding of what testing and monitoring options are there, and the purpose of them in that space, and what we have seen the clinical clinicians actually take place, and how important it is for them to be part of it as the situation is ever changing, and we can see that sort of going on with the advice. So and the benefits of what it means for a clinician to be involved in that space. So obviously we would really like to focus around the employee and the duty of care for all those people, that whether they're based on at home or home working, and how you can in the more digitalize it by having access to video consultations or home visits, as they are obviously quite crucial as well. And then be able to cover as well the in-office screening, so the strategies that we are seeing that work, and whatever logistics are involved to be able to kind of set that up in whatever office environment you are currently involved in. Now, on that note, I would like to ask you, Dr. Katharina, to tell us what sort of strategies we have been able to implement to contain the virus within the organizations, and support HR or employee benefits consultants in that space.
So there's lots of different strategies to help contain the virus, and I think that all workplaces at the moment are, having as much hand washing as possible, and social distancing, and having lots of hand gel, and of course all of those things are incredibly important, and nothing that we're suggesting would be to replace that. Everything is kind of an addition to government guidelines and to what workplaces are doing at the moment in terms of reduced numbers, all of these things that you're already doing. So in terms of strategies, essentially, what we can offer and what is important is testing. So testing is, there's lots of different types of tests, and essentially the different forms of tests, the more different kind of types of tests that you have, you can approach the problem from different angles rather than just tackling it in one way. So PCR testing, there where the arrow is the gold standard of testing. It's the testing that you'll have seen on the news. It's the testing that that Test and Trace uses. It is the only type of testing that you can use if you have symptoms. So anyone who's got a new cough, a change to their sense of smell or taste, or who has a temperature, they have to have a PCR test. As I said, that's the gold standard. It's a test that you you do at the back of your throat and the nose. It can be done by a healthcare professional. It can be done as a self-administered swab, and then it goes to a lab. So that's the thing, it's in a lab, and so the time at which it's returned is kind of lab dependent sometimes, and we aim to get tests back as soon as possible. It can be within 24 hours. Normally it's within 24 to 48 hours, but occasionally if labs are at very high capacity, it can take up to 72 hours to get the result back from that test. But as I said, that's the gold standard for anyone who has any of those cardinal symptoms. And then there's antibody testing. So antibody testing is not a diagnostic test. It tests if you've had the virus. So antibodies are what your body produces after the virus has been in the body as a means to defend you in the future. It's a bit of a difficult discussion because we don't know exactly how long antibodies last for, and we also don't know if every single person mounts antibodies when they've had the virus. So this is a blood test anyway, and it can tell you whether you've had the virus, or it can tell you whether you've got antibodies. So if you do have them, the test will detect it. But if you don't have them, it either means that you've never had COVID, or that you've had it, but your body doesn't have the antibodies anymore.
Yeah, exactly. And I think, antibody testing kind of played its part a little bit, but then since the other reports were kind of coming through, we were also learning on what strategy antibody test actually has in that space. So One of the new things that we have been able to almost advance in a way is the rapid antigen testing. And we know how, and I've been really looking forward to something like that to be available. The reason is that it kind of brings some form of normality to the office space, and as we at least know that we don't have the virus now. So could you tell us, like, what sort of what sort of value it is actually the test is actually bringing in the work environment, and what it means to an organization to have something like that in place?
Yeah, definitely, Lucas. So if you think back to that last slide where you had PCR testing, there's PCR testing and then also rapid diagnostic tests. And both of these types of tests are diagnostic tests. And the main difference is PCR takes a little bit longer, and then you have rapid testing, which is done a lot quicker, hence it's called rapid testing. Now, we can offer rapid antigen testing, and the way in which we have seen it be useful is in a clinic scenario. So it's a screening tool rather than diagnosing someone who's got the main symptoms. So there's lots of other grey symptoms, which can be coronavirus. They're not the main three symptoms of coronavirus, but they are symptoms nonetheless. They're documented symptoms, and these symptoms can be anything from loss of appetite, which could be on the one hand COVID, but on the other extreme it could be appendicitis. So there isn't really a way to say loss of appetite means you have to isolate, you have to get a test immediately. So loss of appetite, something very vague like that, or a headache, or diarrhea, or nausea, or a slight rash. These are very vague symptoms which are documented, but if you have these symptoms, you don't have to stay at home at present, so they're not included in the isolation rules. So where we see rapid antigen testing is as a fantastic tool to screen. So anybody who already doesn't have the three main symptoms, and they're not in isolation, and they have to go to work because as per the government guidelines, if you can't work from home, and you go to work. So if you're at work at that point, this would be a perfect opportunity to exercise screening. So we would screen everybody that was there, and the aim would be to pick up somebody who was asymptomatic, or to pick up somebody who had the atypical features. And the results would be available within 15 to 30 minutes, and thereby it kind of gives an additional stop check to ensure that your workforce is COVID-free.
Yeah, and I can see the test looks quite familiar.
So so the little cassettes, exactly. The test is done at the back of the nose, and then it's put into a medium and then a pipette, and it goes on to this, which is a bit like a pregnancy test. So it's very easy to read, if that's what you're thinking, is it?
Yeah. So I guess that
exactly, yeah.
must isn't it?
Yeah. So that one's negative. The person does not have COVID in this test.
Not in that room. Glad to hear. Thank you so much. Oopsie. And on that note, we obviously together have been in part of conversations with business leaders, with HR professionals, with consultants that have been trying to tackle all the challenges that there are. And in terms of proactivity of all the businesses that are staying operational with the rapid testing, and we even have some guests today that have joined that already have that in place, which is great to see. But what sort of things would you say are important when you implementing a program like that? Obviously, because everything is new, like every week something is changing. So for them to stay operational and be able to maintain a business continuity.
Sure. So I don't think any business is the same, and because, as you said, we've had lots of discussions together in trying to keep businesses open and trying to keep them functioning in the safe way possible, and we've come up with kind of individual solutions for different businesses. So this is kind of a general overview of the rapid testing, but it might change from business to business and how we set it up. So it's the screening clinic, as I said. Obviously, the more you test, the better it is, because you're more likely to pick somebody up. So regular testing, it can be everyone that's there, it could be a sample of people, but the more you test and the more people that you test, the more likely to pick it up. But still, basically testing anybody is better than testing nobody. And where you've said there, positive test action, we would screen everybody. If anybody turns out to be positive, as I said before, the gold standard is a PCR test. So we would be able to offer them a PCR test at that point, or isolate the person, send them home, and then they would either contact the NHS, or we can send a sample, or we can send a test to their house. So it's really just a measure. If you think about it like the Swiss cheese model, so you've got your holes of the possibility of the virus going through. This is definitely not a foolproof solution. It's definitely not a solution to the problem. It's just an additional stop check. It's an additional point to check that people have not got the virus that are at work, and to screen them. And it's just closing off one of those holes in the Swiss cheese. That's basically what it is. And by doing that, you can feel reassured that at that time nobody has COVID, and employees can feel reassured and possibly reduce anxiety as well, which mental health is a massive part of this, and I'm sure that screening staff will increase the well-being and mental health of employees as well.
Yeah, so and some of the questions that we have been getting, I mean, like how often do you do it? Daily, weekly, fortnightly, and I guess where is your stand on that?
As I said, I think the more you test, the better. Essentially, screening is screening. The more you screen, the more likely that you are to have a safe environment to pick up somebody there. Because what you're aiming to do is pick up that person who's asymptomatic or atypical, stop them spreading it and infecting your workplaces. The more frequently, the better. But every business, again, as we said, is different. Some people have they swap their employees on a 2-weekly basis that are in the office. Some people have different groups and bubbles going in at different times. Some people have just a very low percentage of people that are there, or they have staff spread out at different locations. So I think it's difficult to say a one size fits all, and it's just a conversation, and we can try and figure it out and come up with the best solution for a business in terms of the thing that makes sense.
Yeah, totally. Very much sort of needs to be a bespoke thing, and
yeah, I would say so.
Office environments, they can be manufacturing businesses, they can be, and we have seen like elements where businesses are spread out throughout the country, and that kind of brings another element to it, and how we look into implementing that. So totally. And on the logistic front, so we have been obviously quite cautious around, right, testing is one thing, but the logistic is quite crucial. And then the detail service around how the scope is looking like. And here what I think is quite important to mention is that once you have someone that tested positive, what does that scope look like, and what the advice would be there? So could you guide us a little bit more around that, like someone tests positive in the office?
Sure. So essentially we need to act on it quickly. As I said, there's no one size fits all, and different businesses that we've been working with have been doing different things. And we can discuss that. I think it's important that we would discuss that before a clinic was started. So it might be that we identify that person, and then immediately we can isolate them, take them off the premises, and then they would have to go home. Or we would isolate them, we can put them into a room and then do a PCR there before sending them home. But it would essentially be just to act on that quickly.
Yeah, and I guess on the front of kind of being communicating with the employees as well, is that what is quite crucial is that they can expect of what is happening. So this is obviously all the information around how the test is being done. So that is, it's the nasal swab, yeah, and things like that. How long does it take, and how quickly you get the result, I guess. And I think we will kind of cover that as well. But the clinician supports whilst you are administering the test. Like, can you tell us a little bit more of why it is actually quite important of having a clinician on site and having that support throughout?
Yeah, definitely. So the clinician on site, these tests have to be done by a clinician. And the clinician on site, we've got employee information leaflets we give out to kind of explaining the limitations of the test, how the test is done, giving all the information about that. And then, you know, the clinician is doing the test essentially, so they can make sure that it's done in the appropriate way. With PCR tests, we have the option for, as I said, the clinician to do a test or for it to be done at home. Obviously, when a clinician does the test, they're experienced in doing it, and it's more likely that they will do it correctly. When somebody's doing it at home, there are instructions to follow, but it's not, you know, it's not the clinician that's administering it, and you can't ask questions, etc. at the same time. So that's the benefit of having the clinician doing the test.
Yeah, because I mean, it's a bit of a personal story. I was obviously tested a few weeks ago, and the experience of putting the swab all the way at the back of your nose. I mean, honestly, one of my neighbors compared it to giving birth. She had to have it as well. Like, so you can imagine, like, go and do it yourself. It can be quite challenging. And then in terms of sort of setting it up and making it safely, would you mind just adding a little bit on that front?
Yeah, so in the clinic settings, the healthcare clinicians would go in first, set up the clinics in however the way that was discussed, and basically set up the clinics. They would need somebody from the side of the employers to help with the test, as in to relay the results back so that we can act quickly, as we said, on that positive test. So there needs to be somebody from that side of things to help logistically. But again, that's a discussion. It might be that your HR manager just gets a text if somebody is positive. But again, we also need the consent of everybody that's being tested, and that's part of the consultation process that happens with the healthcare professional. So you would get consent, make sure they have no symptoms, etc., before doing the test, and then it would just be that we need to relay that information over.
Yeah, so I guess on that front is about having that nice and clear purpose of communication between us kind of supporting and then whatever the business is requiring, and how quickly we can pass on that information so that no outbreaks are happening inside, and then we're protecting the other employees that are in the office.
Definitely, and that's why it's a bespoke clinic that's set up, because all of these things are pre-arranged. We've discussed what we're going to do with a positive. We've discussed how it's going to be laid out, how best to work around the space in that environment, and that's why it's a bespoke thing that's set up. And it would be a individual discussion to make the best of the space and to get the best fit.
Fabulous. So, I mean, we've obviously covered quite a bit of that duty of care being in the office, but I think, you know, we almost we have to remember nowadays, because that will be a continuity, I hope, for the businesses on how they will evolve. So in terms of, you know, we obviously have some businesses that is essential to be in the office. There is quite a significant number that that employees are working from home, as we both know, as we both are doing now, as we have that webinar, and as everyone else sort of sitting at home in their pajamas and nice shirts, as we all are used to be. How do we look after those people that are working from home? Because I think, you know, that's the lot that we almost have to look after more than ever before.
I think so. I think our company is called GPDQ. It stands for GP Delivered Quick. So we can basically help anybody who is at home, and that's essentially what we do as a company before anything else, before our clinics, before various things. We are GPs. In the NHS, GP consultations, a lot of them have moved to telephone, to kind of a video consultation, and definitely we can offer that as well. So we do telephone consultations, we can do video consultations for anybody who has any range of problems, whether it's they're at home and they have, I don't know, a mild temperature, but they have some urinary symptoms and they're thinking, is this COVID? Should I have a discussion about this? Whether they have, coronavirus symptoms and they want further advice, whether somebody's not sure whether they need to take a test or not, whether it's mental health because you're at home, or whether it's, something completely different that you are sitting at home and worrying, women's health related, anything basically with your GP about. If it's something I'm losing weight and I've got that concern at the back of my mind, essentially we are GPs and we can offer all of those different facilities, and also face-to-face appointments, home appointments, which we love to do. Essentially, that's what we are. We're GPs. We want to see people.
Yeah, and on that note, I might be a bit not cheeky, but actually ask, like, from your consultations that you see, what do you, and I like, this is overall, like, what do you see that is, from a percentage, like, right, this is becoming almost a bit of a challenge to an extent? Do you think that mental health is there growing, or is the desk setup, the physio element that is quite crucial? There was the skin elements that people can be worried about. Is there anything that you can kind of tell us what is actually happening, just like quickly?
Do you know, one of the things that I see the most is stubbed toes.
Right.
Because the home is not set up for working, so we see a lot of stubbed toes. But on a more serious note, apart from stubbing toes, obviously people are working on the sofa where they should be at a desk. You're getting back pains, you're getting neck pains, all of these things that, maybe somebody is putting on weight and they haven't, if they've got diabetes, they haven't had their blood tests for a while, health checks, which are becoming slightly delayed now because of COVID. That sort of preventative care and people's well-being, alcohol maybe has gone up, just those sorts of things. And then actually, to be honest, on the other extreme, you've got people that are at home and they're thinking, I want to take the opportunity to really, look after myself. I don't have a commute, I'm going to sleep well, I'm going to exercise in the day. So it's difficult, but I think mental health is something that should be talked about. We've addressed anxiety in one of our kind of discussions together. I think anxiety, mental health is definitely something that needs to be a conversation that is being had, because people at home, maybe if you're living on your own, you don't have the interactions that you had before. You might be worried about other family members. If there was ever a reason for anxiety, it's at the moment. And I think we need to pull together and be able to have those discussions with people and make sure that everyone, and I'm not just talking about employees in this instance, but everyone has access to healthcare. That needs to be something that's done on the NHS as well, that, we make sure that we address mental health that's going to become a problem.
Yes, in a way, that picture kind of represents the modern way of working, like having the kids and the sofa.
Exactly.
Just name how many challenges we can face, apart from, being quite grateful for being able to have a little one on the sofa and working with you. But you can probably address a few things there that can become a challenge in the future.
I think he's going to have some back pain there. His posture wasn't great.
Yeah. On that, yeah, exactly. So things like that, so it's quite important to address when we having those consultations, particularly on the video. I think you can kind of pick up things straight away from just having a conversation with individual of their own habits.
Yeah, video and telephone consultations are fantastic, and we've realised as well in the NHS that they are. It's brilliant because it's brought their use forward, and I think that after COVID we're going to continue to hold on to video and telephone consultations a lot more than what we did previously, because we can actually do a lot with them. So there isn't a need for somebody to be sat at home thinking that they can't reach and get medical attention. If there GPs on the NHS are offering it, we can offer it. It's definitely something that can be offered.
Yeah, totally. And we can cover the clinical approach. We obviously, I always say whenever I'm talking to business leaders, HR professionals, and I get a lot of agreement around that on why the clinical approach, having a clinician is quite important. Because at the end of the day, we're dealing with a pandemic. So imagine having someone that tested positive and you just get a test. What do you do with that? So and the environment is obviously continuously changing. Like, this must be like, if anyone was to test at home and find out, right, I'm positive, what do I do now? It's just challenging. So, and where is your thinking, like, from a clinician perspective, on the clinician being involved in that type of testing?
I think that actually, honestly, I think COVID has taught us a lot. And I think it's really shown the resilience of people. So in comparing how people have responded in the first wave and the second wave, for example, people, and it's really commendable, you know, they've read advice, they understand a lot. General public understanding of COVID has, you know, is exponential, really, their understanding process. And everybody has basically learned a lot about it. I think it's difficult because we are expecting a lot of the general public. We are expecting a lot of HR managers, of head teachers, in all these aspects. And it does become a point where I think that people have to, you know, they may be being asked to make decisions. An HR manager is suddenly, you know, they're thinking along the lines of being a doctor. And an office worker is, you know, is having to interpret their own tests, etc. And it is a bit worrying to put that responsibility and put that decision-making process on the general public. I would like to commend everyone because I think that they've done a fantastic job in doing this. And, you know, even in the telephone consultations that I'm having as a GP, the questions have changed that people ask that they were asking maybe 5 or 4 months ago, because the understanding has really increased so much. But what I would say is, as GPs, here we can offer kind of, I think we start at 8 or 9 o'clock in the morning and then we finish at 11. So there's always a GP at the end of the phone who can answer a question and can help relieve that pressure of having to make decisions about tests. So some of the questions that we've had is, you know, this test, for example, is negative, can somebody go back to work? But you have to look at the full picture, as when was the test taken, what was the circumstances, had the person been in contact with somebody else? There's lots of things to be taken into consideration. And I think that sometimes it's not fair to put all of that responsibility on individuals who have suddenly had to assume the role of the doctor, because it's difficult enough for us, to be honest, to keep up. And, you know, with tests that are changing, the environment is continuously changing. At the beginning, as you said, antibody tests were very key, but we've moved forward since then. And things are moving at such a rapid pace that, you know, PCR tests are now fantastically becoming more available than they were before. And we also have access to these rapid tests, which is a game changer, because if you can diagnose somebody and if everybody knows and has a clearer understanding of whether they have COVID or not, I mean, it's obviously going to change how things work. And then we've got the possibility of this vaccine, which is incredibly important as well. And I think that's the difficulty, is navigating and understanding in the environment, which we can help to do, and offering the continuity of care. So, you know, if somebody tests positive, for example, we can give advice on what can happen in the future, what you need to do, etc. And those things that are very important.
Yeah, I cannot agree more. Right, so we are in this moment in time where we would like to see what sort of questions we have been asked. And as the tech goes, I'm trying to find out what we have been given. Right, so I have one question here. Can testing get people out of isolation?
Okay, so that's a common question. At the present, no. So if, for example, you have been in contact with somebody who has COVID, you need to do the full 14 days of isolation. And the reason for that is that if you're tested, for example, on day 3 or day 4, it might be that you just are not testing positive at that point, but perhaps you may go on to be positive at day 7 or day 8. So testing to try and avoid that situation would be dangerous, because you could potentially then continue to spread COVID if you were to get it at a later time. The only reason that you would do a test in that time frame is to then, if you're positive, that can maybe affect other people that you've been in contact with already. But a negative result wouldn't change anything if you were in isolation already, if that makes sense.
No, totally. That makes sense. And another question that I just received, and feel free to add more on the Q&A field if you have any additional ones, because we've got about I think another 5 minutes to go through any questions that we may have to our wonderful and knowledgeable Dr. Katharina Crystalis. One more question that I can see now. How could we help to prevent us from having an outbreak? I think, yeah. How can we do that?
That's a $1,000,000 question, isn't it? I think that question is probably best answered on many different levels. So I think it's about responsibility. So each individual has their own responsibility. If you're unwell, for example, and you have, don't go to work even if you haven't been tested yet, be aware of the rules that there are. Make sure you're up to date with the rules, and act on the rules. If you've been in contact with somebody, then obviously don't go to work, and notify your HR department as soon as you can. Testing has a role, obviously, because screening people, you can help to stop the spread of anybody who's asymptomatic and spreading the disease and they didn't know, and thereby helping to prevent an outbreak in the workplace. Mm-hmm. And obviously, the big question about the vaccine, which is going to play a huge role. I don't think for the time being, I don't think that we'll see that have a massive effect on society in the next few months, but looking forward, I think that is something very exciting.
Totally. One more question that I can see, so I'm trying to navigate the world of digital webinar and being able to answer questions to everyone that is engaging with us today, which, as you may imagine, sometimes can be interesting. So, all right, okay, that's an interesting one. We both know answer to that question. Like, do all of the GPDQ GPs also work in the NHS as well as with GPDQ? And we know it's yes, but why? Do you think it's a really good question. So why do you think it's important now than ever before?
I can't answer that in 5 minutes, but I'll try and give a quick answer. As GPDQ, we are very proud of the NHS. We were all trained in the NHS, and it's part of our it's part of who we are growing up in the NHS, I would say. So we want to make sure that we give back to the NHS. We want to make sure that we stay up to date. We want to make sure that we give back. We want to it's just the right thing to do, essentially. We all believe in the NHS, and so this really is a way that we can work alongside the NHS and try to work in partnership with it, and doing maybe part-time GPDQ to supplement our NHS work, but it's definitely not an alternative. We all believe firmly in the NHS and work in it.
Yeah, that is something that I'm very often quite proud of, I must say, because being part of the solution, not part of a problem, serves a different purpose. So a good question, and hopefully, we have explained it quite well on why do we maintain on work actually having NHS only working GPs, not private. So hopefully that has answered your question. And I've got someone that who is interested in discussing with us the possibility of setting up COVID testing within their offices, and also employees who are working. Is this something that GPDQ can help with?
Definitely.
Yeah.
We're having a number of conversations, and we've enrolled this in different businesses already, so we'd be delighted to help you with that.
Yeah, and I guess it's we can be quite transparent that there's also an element that it's not only organizations. We have also been working quite closely with the NHS to help with testing, and that's on the national level. Right, okay. I think that there is another question that I have, and I would like to believe we still have a few minutes here. So the vaccine, like, what is happening on that front? Would you be able to say, like, right, okay, I mean, obviously, there is a government element to it where we think, it's really important to serve the vulnerable first and whatnot. But do you think that, organizations like ours will have access to vaccine, and or it's actually more important that NHS has it now, which kind of makes sense, but like, do you have any view on that?
Well, all I can say, I think it's just so exciting, and all of this has really happened in the last week or two.
Mm.
that there's been the thought of the vaccine on the immediate horizon, actually. So I think that what's going to be to happen first is it's going to just be available to the NHS, which I think is correct, and it's just going to be available first to the over 80s and then maybe the over 70s. And essentially, what a vaccine is it's there to help prevent you from getting the disease, and so it makes sense that it goes to our most vulnerable first. And I think that's how it should be. After that, it will go to frontline kind of health workers, and that's also the right thing, because then it will stop them spreading it to everybody that they come in contact with. So, you know, before COVID, as NHS professionals, we were required to have a flu jab, and that wasn't for our benefit. That was to help us stop spread it to somebody else that we would come into contact with, because we obviously come into contact with elderly and vulnerable. So I think that first we're going to see the elderly and the vulnerable, and then we're going to see healthcare workers, and then hopefully we will see it trickle through society as quick as possible.
Mm-hmm. And you know, we're still in the kind of flu vaccination period. What importance that plays whilst we are having to deal with the pandemic?
It's important, isn't it? Because you know, if you can be vaccinated against the flu, it just, you know, you don't want to get the flu, and you also don't want to get COVID, and it's just a benefit, isn't it? I've had my flu vaccine.
Yeah, so that would certainly prevent. I mean, I guess in the kind of workplace environment, is that, you know, you may be coming in when you have a flu vaccine done already, it prevents from the individual coming into the office with the flu-like symptoms that potentially can be COVID, and will effectively means, you know, that business operation may be at risk because you're now showing symptoms of this other flu that has been happening for years and whatnot. So I guess that is quite important.
Yeah, I think that's it, is that obviously all the focus is on coronavirus at the moment,
Yeah.
but the flu has been around for years, and it is still important. It is still an illness that we need to vaccinate against. And fantastically, we have seen a huge uptake in the flu vaccine. And I think that that's one of the positives that will come out of this, is going forward in the future years, there will be a continued uptake in the flu virus, the flu vaccine.
Okay, wow. So GPDQ, who's that? So some of the things that we proudly have been able to support businesses and organizations and whatnot are the in-office GP clinics. I mean, obviously, that is an element that now is potentially happening less than ever before. But what on that, like, you know, we moved some of our in-office clinics to digital clinics as well. But where do you see the in-office clinics? Because that you might have been aware, like, there have been happening. There are organizations that have on-site doctors. Where do you see how important that will be, sort of throughout and past COVID?
I think it's always important. Because of COVID, people have probably worse mental health, but also, as I said earlier, other illnesses haven't stopped. People still may be having any myriad of normal physical health concerns, and having rapid access to a GP is only going to be beneficial.
Mm.
Whether that be if it's a video clinic, if it's a face-to-face clinic, which probably there are not at the moment, but maybe that will return after the vaccine. Having access, easy access to a GP is, as I said, only beneficial.
And I mean, what we tend to do, as you are well aware, is kind of assign the doctor for the continuity of care. Like, from a personal experience, like, I wouldn't want to go in and see different doctor every time, because you kind of have to repeat yourself in a way. I mean, I know that we live in the age where we have electronic health records, and doctors can kind of quickly flick through of what sort of is wrong with you. But from your side and the patient experience, how important it is to have that continuity of care.
Yes, it is important. And it's also, it makes our job more enjoyable as well, having continuity, because you can get to know somebody and can talk through their problems, and it makes it worthwhile starting with somebody at the beginning of their problem and seeing them a few times and be able to come out at the end and have a mutually agreeable plan. I mean, that's what we enjoy as doctors. We don't really enjoy seeing somebody with a one-off thing and then somebody else seeing them after. But it's obviously beneficial to people, and especially going forward as we keep talking about mental health, that mental health is going to be an issue, especially with mental health, seeing the same face, because you open up and you confide in somebody, so having that continuity is hugely important.
Yeah, so I kind of picked up, it's basically a proactivity of what you can pick up from having the conversation with the same person, because I guess, you know, out of us talking together, we can pick up when we have good days, when we have better days, and then this is when we can kind of almost ask that question that is maybe at the back of our head, that is not necessarily coming up. So yeah. Another thing that and you know, the home visit piece, it's an interesting one, because this was sort of an element that we have been used to back in the days when you had doctor visiting. Like when my daughter is watching Peppa Pig, I'm like, oh, the doctor is coming at home. I'm like, oh my god, like this is obviously not happening anymore that often. But I mean, from a doctor experience, and you have been seeing patients at home, why do you think it's kind of a good element to have access to?
Seeing somebody in their home, you can see, and you know, you can pick up so many more cues because you're in somebody's environment. It's also when you're feeling sick, you don't want to really go out to see somebody. So we have continued to offer home appointments, obviously with full PPE, to keep the patient safe and also to keep us safe and to stop us spreading illness from one person to another. And it's another option. So if telephone and video are not correct, we can, of course, and we have been seeing people at home.
Yep, great. And we covered the flu vaccination, so that's obviously something that we're not only working with doctors, so that we have healthcare professionals like nurses and healthcare assistants and pharmacists that are able to support businesses with that program. Pre and post travel health screening, so I'm kind of reading that out, but that is quite an important now, because like some of it is not happening, and but for businesses the travel is still allowed. So how have we been supporting businesses? What have you seen basically happening?
We've been supporting businesses, but also individuals when there wasn't the lockdown, because of flight requirements. So often, and it's obviously country and flight dependent, somebody will need a PCR test prior to flying, and that varies from a week to 72, I think maybe 48 hours even, that you need to have a test. And obviously we can help with that, and we'd be very happy to.
Yeah, and I guess, you know, the PCR test is now still a very much so a requirement from our other countries if you need to travel somewhere else. So that has been something that I have been asked quite often. The occupational health is another element, service that we have been supportive of, and that is, I mean, you know, we are working from home, but is there anything that you would want to add on how important it is to now look after staff and obviously those people that are maybe off, and how it is important to have the report being available to the employer that is a little bit tailor-made to what their requirements are? Because what I can see from an experience working to businesses, that a lot of those reports are very much so, you know, basic on what is given to the employer back. But I think, you know, now more than ever before, it is quite important that you get a little bit more of a tailor-made approach rather than just a random version of a report. Where's your stance on that?
Well, I think so. I think that COVID has shown us more than anything how much of a grey line there is between somebody's mental health, physical health, but also their occupational health as in going to work, and really how much all of these things are combined, and how important that they all are. We have been working with some businesses, which is what you've been talking about returning to work, and kind of doing assessments of people before they return to work. And I think the benefit of that has been that we have been able to isolate maybe people who are at higher risk of returning to work because of their medical comorbidities, and then people who are at a less risk, to make sure that if a business has to have X amount of people on the floor, they're not the people that are most vulnerable, and those people are at home. And so to kind of work with a business and with people, and also to help businesses understand whose mental health would be better being at work and whose would be better at being at home, and thereby that increases productivity of employees because their mental health is better, they're functioning better, and it also it helps to navigate during this time in deciding who should be at work, who should be at home, obviously within the restraints of government restrictions.
Yeah, and I see that being quite of an important. So, I mean, the other elements that we have been supportive of is obviously access to a psychologist and physiotherapy, and that kind of comes out quite nicely from the consultation, from sort of the consultations that you had recently, when when we had that little lower back of a challenge of having a lower back problem, or of or that mental health. I mean, nationwide coverage is now more than ever before. Employees are moving. I have some businesses that that have employees that are based in London now deciding that they will move up to Scotland. So I guess being able to have that is quite important. And another project of ours is the drive-through testing centre that we have managed to open up in North London. So is that something similar to what you can see in the NHS?
Yes, so it's an elective drive-through service, which I'm very proud of. It gives people the opportunity to have their PCR test in the drive-through facility, which obviously makes it very readily available for people to have, because there's a lot of, or there was, not so much anymore, but difficulty in obtaining a test. And this makes it easily available if somebody feels that they have symptoms. So it reduces that delay to test, and then helps to speed the process of getting the test. And that's obviously a very good thing, because it reduces the amount of time somebody would be off of work. Yeah, and the anxiety of waiting for that test, which is not nice, wondering whether you've had COVID or not.
Mm. Yeah, in fact, I mean, I've asked the question, but I went there myself the other week when I had to be tested. So certainly was massive, added a massive value to myself, and obviously, and we actually, that was the time when you were able to see people, and one of my neighbors was actually seeing his dad, who is a vulnerable person. So that was my kind of worry than ever before, like, right, I'm not that worried of me being tested positive, but actually for the sake of his dad, I really wanted to know, because like, if I was to ever pass it on to him and pass it on to his dad, that would be sort of an awful thing to ever have at the back of your head. So certainly a good value add. Yeah, so that's kind of us on finishing up, and wanted to say thank you for everyone that's been with us today and participating. If anybody wants to have access to slides, we can send them via the PDF. So feel free to reach out directly. You've got obviously our contact details. We will also keep the recording, and so that recording should be available on GPDQ YouTube channel, but we can obviously share that as well, as that will be saved. So once again, wanted to thank to the perfect gift, and remind to redeem your voucher to whoever has joined us today. But more importantly, Dr. Katharina, thank you so much, because it's always it's a must to have you almost in any of those conversations, and I am sure that all of the people that managed to join us today will have a lot of insights and takeaways. So thank you so much.
Thank you very much, Lucas, and for everyone who joined.
Thank you, and hopefully, we will be able to share more of that soon. So stay tuned. Bye now.